Hi, welcome. Today I'm going to be working on the lovely Juliet, and we're going to be doing a pec and neck massage, and I'm going to go ahead and get started. So Julia was talking about some back pain that she was having, and you might be surprised that one of the muscles that I think of first is pec major when somebody complains of certain back issues. So I'm going to go ahead and start with some pec work, and I like to just make contact with my client sometimes before going in with any oil. And I'm usually just really conscious of working slowly. And just like a cat, I like to just kind of walk these shoulders out, and people don't realize just on a daily basis how they are just constantly holding their shoulders in place. They're just kind of always at acute stress. So I really like to just bring some attention to these shoulders. And I think I'm actually going to do a little bit of myofascial work in here. So I'm just going to do a little bit of work on this connective tissue. I don't usually do this kind of work if I'm working on a new client because it can feel really foreign. But I'm basically, the challenge in this position is you want to use like the whole palm of your whole hand basically when you're doing this kind of work, and you can't in this position. So I'm just gonna start stretching out the superficial tissue. And it's just nice if you can kind of come at this connective tissue from different angles. So I'm not really trying to do any work on the muscle tissue itself. Just trying to really encourage all of this to open up and stretch a little bit. And it's a really good sign if you start to see a little bit of redness appear on the skin. And just trying to get close to these attachment sites and really bring release across this whole area. And, to somebody watching, it might seem like I'm really not doing very much, but this kind of work is pretty acute and it does take a lot of focus to do it effectively. And I'm just going to do one more pass across this area. Just trying to get a nice hold on the skin. If it feels too slippery, it's just, you're not really working on the connective tissue as well. And I'm going to go ahead and go in with my oil. So got a little bit of release in that tissue. And I'm going to start just kind of moving into this pec major a little bit more and get the oil where I need it so I don't have to keep going back. And if you are wondering why I'm wearing a ring it's because my hands are really swollen right now and I can't get it off. But I wouldn't normally wear any jewelry doing massage. So getting close to these attachment sites and just working my way down. I'm going to start to really utilize the pads of my fingers. Might find some trigger points in here. And just as much as possible, I'm making sure that I'm working from my core, even seated. So the moment that I try to just use the part of my body that's making contact with my client, I'm just not using my energy in a very smart way. So my arms and my fingers are just an extension of my core, my whole body. And anytime that you want to do deeper work, you typically want to be moving in towards the body, towards the spine. So I'm going to start just kind of working my way into this muscle a little bit more. And I'm using stacked hands for this. This is one of my favorite ways to do pectoral work on women. Feels just minimally invasive. With guys, it's a lot easier. I really like to do active release on like more muscular type guys. So without losing contact, I'm going to go ahead and move to the opposite side. And I'm actually changing the hand that's underneath just to kind of work smarter and not harder, conserve my energy. If you're sensing that your client is on the more tender side in this area, then I would continue to work down towards the shoulder. But if you want to start working a little bit deeper, you can start kind of working your way in. And it's not about like poking the muscle, it's really about connecting with those deeper layers of tissue. And I usually like to give my client just a little break. I'll do like a few passes of just, soft tissue, less focused work. And I think I'll go in just one more time. And I'm going to start to work my way into the neck, into the upper trap. It can feel really soothing to start with some work in the upper trap and work into these medial neck muscles. This is so simple, just this effleurage type stroke, but it usually feels so good. And I am just a huge advocate for suboccipital work, and just feel like it helps to relieve pressure on so many different areas, the neck, the upper back. Really like to work on these suboccipitals. And tension often, the pain that people are feeling, that my clients feel, it's often referral pain from really surprising places. And the suboccipitals carry tension a lot more than people realize. I'm just doing little circles all across the occipital ridge here. Depending on the, issues that my client may be dealing with, I feel like suboccipital work can be a lot more effective than working directly on the occipitalis. It just kind of depends. And I like to just, after doing that, compressive circles, so to speak, I like to just kind of run my finger pads across the upper traps, the SEM, and the suboccipitals. And whenever I'm turning the head, I always do so pretty slowly and deliberately. I just want my client to feel nice and secure when I'm working. If I don't have a whole lot of time, I usually keep, the techniques that I use, to a minimum. I really like doing, a compressive type effleurage. So just applying a good bit of pressure, but keeping it moving. And this is one of my favorite techniques for working on the scalene muscles. And for some reason, that upward stroke, I just get a really nice hold on that upper trap and can kind of dig into those suboccipitals in a really nice way. It's just not the same with that downward stroke. And even if I might be running behind one day, I really am conscious of not rushing just those small little transitions, like turning the head, because a client can definitely start to just sense that you're in a hurry if you're not careful. But boundaries are really important too. So it's just, you don't want to overgive as a massage therapist, and I feel like a lot of us struggle with that. So just having boundaries on time, and you'll always get that client that asks for, another 5 minutes or whatever, and you're already running late, and it's important to be able to say no. And before I forget, I'd like to thank a few of our patrons. I'd like to thank Robert Christ, Black Dove, and Joel Harper. Thank you guys so much for your support. And I really like to do just something for both sides to tie it all in. A little stretch, just a little decompression for the cervical spine. And that's all for today. Thank you for joining us today. I really enjoyed spending this time with you, and I look forward to seeing you next time.